Have you ever wondered how doctors can tell the difference between common stomach upset and more serious, chronic digestive issues that cause similar symptoms like abdominal pain and changes in bowel habits? Stool tests are a very helpful tool for doctors to distinguish between inflammatory bowel disease, often called IBD, and irritable bowel syndrome, or IBS. They primarily do this by looking for specific markers that indicate inflammation in the gut, which is a hallmark of IBD but typically absent in IBS. The core reason these tests are effective lies in the fundamental difference between the two conditions. IBD, which includes Crohn's disease and ulcerative colitis, involves chronic inflammation and damage to the digestive tract. This inflammation releases certain proteins that can be detected in a stool sample. IBS, on the other hand, is considered a functional gastrointestinal disorder, meaning there is often no visible inflammation or structural damage to the bowel, even though symptoms can be severe. When you need a stool test, your doctor will provide a special kit for you to collect a small sample at home. You will then return it to a lab for analysis. The lab technicians specifically look for biomarkers such as fecal calprotectin. High levels of this protein strongly suggest active inflammation in the intestines, pointing towards IBD. If calprotectin levels are low or normal, it makes IBD much less likely and strengthens the possibility of IBS. Fecal calprotectin, a protein released by certain white blood cells called neutrophils, is an excellent non-invasive biomarker because it directly correlates with the degree of inflammation in the gut. Its presence in stool indicates that these immune cells have migrated to the intestinal lining to fight inflammation. This makes it a powerful screening tool that helps doctors avoid unnecessary invasive procedures like colonoscopies when inflammation is not present. Ultimately, stool tests provide a clear and early indication of whether inflammation is playing a role in your digestive symptoms. By identifying the presence or absence of inflammation, these tests help your healthcare team guide you towards the most appropriate next steps, whether that means further investigation for IBD or focusing on managing the functional symptoms of IBS, leading you closer to feeling better.